It's now my pleasure to introduce to you the Dean of Dentistry and Head of School, Professor Richard Logan.
Thank you very much, Nicole, and welcome everybody, and welcome to the online viewers as well. Before we start, I'd like to acknowledge the Kaurna people, the original custodians of the Adelaide Plains and the land on which the University of Adelaide's campuses at North Terrace, Waite, Theberton and Roseworthy are built. So yeah, welcome. It's a great, it's exciting to be able to talk about dentistry and oral health. And let's get started. So the Faculty of Health and Medical Sciences is where the Adelaide Dental School sits. According to the Good Universities Guide, which is Australia's largest course comparison site, the ratings provide an independent 5-star performance rating for every university in Australia, and it's based on student relevant criteria. So I'm pretty pleased to report that the latest results from the 2017-2018 ratings are very good news for the faculty. We're the first in health across all institutions in South Australia for both teaching quality, and we're first in health for overall student experience, which as potential students, that's a very important thing to take into account. So these results reflect the high quality teaching that we have in both the undergraduate programs. So students and graduates. Importantly, the students and graduates win lots of local, national and international awards. These include things like the Rhodes Scholars and the Fulbright Scholars. So it's quite significant international awards. The Rhodes Scholarship perpetuates the commitment to learning, research and humanity of businessman and philanthropist Cecil Rhodes, and helps to support students who demonstrate a strong propensity to emerge as leaders for the world's future. So the University of Adelaide has up to about 110 Rhodes Scholars as part of its alumni. The Fulbright program provides an international educational exchange for scholars, educators, graduate students and professionals, and was founded by United States Senator J. William Fulbright. So these are really important awards and add to the profile of the faculty and also the university. In terms of the faculty itself, we've got lots of leaders in our fields, different fields. We have world-class researchers who are active in both teaching and research. So these are people that you'll come across in your studies. So their work as researchers informs the curriculum and really makes being at the university a very exciting place. Importantly, the building that you're in now is a fantastic facility. It opened in February last year. It's a 14-floor, $246 million building. And it really signalled a new era in health education in the university. So not only is it a new building in itself, it's located in the new biomedical health precinct. So we're right next to Samory, the cheese grater building next door. We're also right next to the Royal Adelaide Hospital. So this is a fantastic opportunity for our students. So there's about 1,600 students that spend time in this building itself, along with about 600 researchers. And as well as the Adelaide Dental Hospital on the very top floors, we've got laboratories, and we also have the medical school and the nursing school and School of Public Health within this building as well. So it's a very exciting place to work and to study, and you bump into not only people from dentistry and oral health, but also from other health professions as well. So here's a video to show you.
When life is in my hands, I will be prepared.
When I am needed, trust me to provide care and support to people and their families.
I will improve health and well-being by delivering cutting-edge oral health care.
To develop the knowledge and skills I need to succeed.
I chose to study at the University of Adelaide.
The new Adelaide Health and Medical Sciences building will take my studies into the future and transform the way I learn.
As part of the Adelaide Biomed City, I am a part of something big.
I'll study alongside future colleagues, learn from leading academics, and build relationships with industry partners.
I'll be connected to innovative research, provide real patient care,
and will gain hands-on experience using the most advanced simulation equipment in Australasia.
Working alongside dental professionals, I will deliver oral health services to South Australians.
Together, we are the future of healthcare. We will be prepared, and we will lead the way.
Okay, so that's just a bit of a quick snapshot of this building. To talk about dentistry specifically, the Adelaide Dental School is internationally renowned in terms of its research and teaching. It's currently ranked 31st in the world, so it's in the top 50 internationally in the world, and it has the maximum rating, which is well above world standard in terms of its excellence in research. We're almost 100 years old. As of next year, the school turns 100, and we've been treating around about 500,000 South Australians each year. Well, we've treated about that many people. Our programs are fully accredited, and at both undergraduate and postgraduate levels. And yes, so if you study here, you have a first-class clinical experience. We have Australia's most advanced simulation laboratory for dentistry and oral health. We have a state-of-the-art dental health clinics. As a result of this building being built, I think we probably currently have the best clinical facilities for a teaching institution in Australia, if not the world, at the moment. And there's opportunities for students to work not only here, but out in the community, which is something we think is very, very important, and also out in a lot of rural centres. So our students go out to Whyalla, Berry, Port Lincoln, Mount Gambier, as well as lots of community clinics within our local Adelaide region. So the dental simulation clinic is a really important part of the clinical teaching. As you can imagine, doing dentistry and oral health can sometimes, well, it's important that you know what you're doing before you actually start doing things on patients. And the dental simulation clinic provides a perfect opportunity and environment to learn technical skills and actually make mistakes if you need to, without actually doing it on a real patient. So this is a 90-chair clinic where you have plastic heads, as you can see here, and you can practice dentistry. It's all set up each like a dental clinic. So that's a very, very important time. And as students, particularly in all years of the program, you'll spend quite a lot of time in this clinic. In addition to the rural and community clinics I was talking about, the school has a strong community outreach focus. The school has its own clinic in the Common Ground housing area in Light Square, just nearby here, where we treat patients who come from disadvantaged backgrounds, people who are homeless, people who aren't eligible for public health support. So this is a really important initiative that the school takes very seriously. So there's lots of different clinical experiences that you can have as a student in the dental school. So the oral healthcare team doesn't just include dentists and oral health therapists. You'll be working alongside a whole lot of other people who form part of that team, including hygienists, dental therapists, dental technicians, of course dental assistants, and also people who do dental prosthetics, so dental prosthetists. So it's being part of a team and working within a team is a really, really important quality that you need as a dentist or oral health therapist. One of the key things to know about is what the difference is between dentistry and oral health. So the scope of practice is a little bit different compared to the two specialties. The Bachelor of Dental Surgery, you do a 5-year undergraduate program and you're qualified as a dentist at the end of that. You're fully registrable as a dentist and you do the full scope of practice within dentistry. The Bachelor of Oral Health program, which leads to you being an oral health therapist, is a 3-year undergraduate program, and the graduates qualify as oral health therapists. They have a slightly a different sort of scope of practice as a dentist does. Maybe not quite the full breadth, but certainly plays a very, very important part of the dental health team. So I think one of the things that's really important to do is find out as much as you can about the programs that you're interested in. And one of the ways to do that is to talk to people. So you can go and see dentists, go and talk to dental specialists, oral health therapists, dental hygienists, dental therapists, and find out as much as you can about the profession and the job that these programs lead to. So these people might be working in private dental practices, community dental clinics, school dental clinics, dental hospitals like on the top floors of this building, or in other sort of clinical environments. So find out what they do, why they do what they do, and why they enjoy their jobs. And also it's important to know about any challenges within the positions as well, because you need to be fully informed if you're going ahead with this kind of a program. So, for dentistry and oral health, it's really important that you have some certain qualities. You really need very effective communication and interpersonal skills. As dentists and oral health therapists, you're dealing with patients every day. You're talking to people, making sure they understand what you're going to do to them, and make sure you need to understand exactly what they want you to do to them as well. And because quite a lot of the things you're doing as dentists or oral health therapists, in some cases can be irreversible procedures, sometimes surgical procedures, you need a high degree of professionalism and good ethical behaviour. Also, because it's very technical, both dentistry and oral health are very technical programs, good manual dexterity and fine motor skills are very, very important. So these are all things to consider. As I mentioned before, with these programs you're working in a team. So good teamwork skills is really, really important, and being able to demonstrate that is very important. The other thing with dentistry and oral health, like all health professions, things are changing all the time. There's new developments, there's new technologies. So being prepared for lifelong learning is something to consider with this. And also continuous reflection of what you're doing in the clinic and what you're doing to patients and how you're working as a health professional is very, very important. So in terms of preparation for study for dentistry and oral health, there's a very strong clinical basis to these programs. So you will be required to go on clinical placements in different areas, and as a result of that you have to go through some communicable infection clearance, so things like bloodborne viral infections, HIV, hepatitis B, hepatitis C clearance. Also need screening for tuberculosis, and also need criminal history checks. All good fun things to have to go through, but fairly painless. There are some student incidental fees that the admissions team can tell you more about, and for international students there are English language requirements. So important to be aware of those things. So just briefly, and the others will tell you more about this in a little while, for both programs the first year, or all years, really involve full-time attendance. It's different from some of the other programs within the university where you can be a bit more flexible in how you approach your studies. These require full-time attendance in the clinics, in the lectures, tutorials, seminars, and whilst they can be challenging and time-consuming, it's also rewarding learning opportunities. So being here all the time is important in terms of working with your colleagues in the first year as well. And from the first year you'll be working within professional learning clinical environments. So that early clinical exposure is a characteristic of this program. So early clinical experience, particularly a strong simulated clinical experience in the first years of the program is important. A lot of the work that we do is patient-centred, so a lot of the learning that we do is centred around patient care. Another key thing with our program is we have very low staff to student ratios. So in the clinics, for example, we'll have 1 clinical tutor to 6 students. So you have a very focused learning environment. We've got award-winning clinical teaching staff, and in terms of the learning modes, there's a lot of small group activity. So a lot of the small group activity in the clinic is a key part of the program. There's obviously lectures and class meetings. There's lots of simulated clinical sessions and practicals, and also good online learning environments as well. So I'm going to leave it there and ask Kathy to come and talk about the oral health program. So thank you for that.
Thanks, Professor Logan, and good morning everyone, here and online. I'm the current program coordinator for the Bachelor of Oral Health program, and as Professor Logan mentioned, it sits alongside the BDS program here at the Adelaide Dental School. And it's certainly, whilst a standalone program, we have a lot of integrated learning opportunities with the dental students, because what we want to do from day one of our program, and the same in the dental program, is work as a team. Because in graduate practice, that's exactly what we do. So in our undergraduate experience, we want our students to have that same degree of teamwork. Having said that, the oral health program, a 3-year undergraduate program, does consist of its own subject areas for specific, what we call streams or courses, that are very integrated. You enrol into the 4 courses when you begin, but the courses are linked, so that when you're doing a particular activity or topic in one course, in a practical course you'd be practicing that activity. So we try to integrate it very closely. We have our students in the clinic, in their preclinical subject, in week 2 of first year. So as soon as they can get their blue dental jackets purchased, they're in the clinic, not extracting teeth or doing anything too complex. But what we know is that the sooner we can get our oral health and dental students working in the clinic, they're thinking like clinicians, they're communicating with each other, and at the end of the day, the job is not just doing the technical aspects, which are very, very important, but it's the ability to communicate with our patients. And I'm sure as current dental patients and prospective dental professionals, you'd agree, that is probably the most significant thing. So we have a big emphasis on all areas of the profession, but we try to integrate it. So if we're learning something theoretically about the anatomy of the head and neck, we put it into the context of, why do you need to know this? And why might that be important coming into a clinical role, when you need to understand the good underpinning knowledge? So we build that into the program right from the beginning of first year. A career in oral health, I guess the challenge we have in our course is it's a relatively new course. The dental school celebrates its 100th birthday next year. The oral health program is almost 20 years old, so it's relatively new. And it's an emerging profession. I often compare it, and people understand it often more easily when you think about a physiotherapist and a podiatrist and how they might work with a doctor. So it's a similar sort of thing, where the dentist is the head of the dental team, but many of the procedures that are done that aren't particularly as complex are done by the oral health therapist, as well as a lot of the prevention. So when you go to a dental practice, you'll see the dentist, you'll see the oral health therapist, and depending on their scope of practice, they'll both work with you to get the best outcomes for you as a patient. So our graduates are quite diverse, and we've just had our graduation from our most recent lot of people completing the course, and they're working in specialist practice, they're working in private practice, they're working in the government. Some have gone up to Queensland seeking warmer climates, I'm sure. One of them's working in a mobile interdisciplinary health program, working with other health professionals like physios, speech therapists, doctors, dentists, and she goes around to aged care facilities and community health centres and does a lot of screening and oral health education. So the potential for practice is really as wide as you want to make it, which I think is really exciting. Some of our graduates go on and study dentistry. This is not a stepping stone to dentistry. People who are doing oral health don't get automatic entrance into a dental course, but many of our graduates decide they'd like to continue their studies, and they go through the usual application process for dentistry and go on. But I think it's a really exciting course, because you really don't have to be bound down by any expectation of what you might do. Many of our graduates have gone on to research and PhD as well, and they're currently working in dental research. So the outcomes are really only limited by one's imagination. So just to briefly cover the domestic overview, we've got a new focus this year on, I suppose, we're reintroducing the UMAT as part of our selection process. Historically we had this, and it was then removed. We've found that we're getting far too many applicants, which is a good thing, but we have to interview far too many people. So our UMAT inclusion is to hopefully be able to still get a fantastic set of students. And I want to point out that if people are interested in doing oral health and are put off by the UMAT, please don't be. Some people think they've got to get the same score that they need to get into medicine or dentistry. That's not the case. It's part of our selection process, but we won't be looking for those extremely competitive scores that are required. So please don't be put off if that's your main focus. And then you can see it goes along with your SATAC application. We have a personal interview, which is very important for finding out your reasons for doing the oral health program. There are some study prerequisites which are in the program, and then we do a combined entrance score. So it is competitive. We only take about 35 each year, but we like to think that we really try and give everybody a good opportunity to show us their commitment and their passion for doing oral health. So that's just the information about the UMAT, which is in the information for the courses, and of course reminding people there is an early application date for both the UMAT and for application to the oral health program. And all this, of course, is in the admissions guide for 2019. I'm now going to hand over to the program coordinator for the Bachelor of Dental Surgery, Associate Professor Dimitra Lekis, who'll take you through information on that program.
Welcome everyone. Can you hear me at the back? So thank you, Kathy, for the introduction, and thanks all for coming out and finding out more about our dental school and the undergraduate programs that we offer. So for dentistry, maybe I'll just talk a little bit about our program. So you've all heard it's a 5-year program that is full-time, and just like Professor Logan and Kathy said, it's our teaching philosophy is when we immerse our students in a clinical hands-on learning experience right from the outset. We have one subject in every year level, so it's a fully integrated dental program, unlike most of the other programs in Australia. So it's one subject called Dental Science and Practice, and we integrate the clinical sciences, the clinical practice with the biodental sciences. So it's not separate subjects like we used to have, it's all integrated. And this is so that you can fully understand to be able to apply the theory to clinical practice. And we've been running the program like this for the last 10 years, and we think it's a successful way to teach our students. And from first year, it's quite intense and big transition from high school to university, and our student panel members, feel free to ask them later to tell you about this transition. We have lots of support systems and mechanisms to help you all succeed once you enter our programs. And one thing that we also like to reinforce, and I like to reinforce as the program coordinator, is really do your homework and research about this career. It's a very flexible and diverse career, and just like Kathy said, that you can work full-time, part-time, private practice, public practice. Once you're registered and finish the degree, you're registered to work in Australia. Those of you who are international students need to check the admissions guide, and it has information about what can happen, where you can practice after that. So Nicole will talk a little bit about that later. But once you can work anywhere in Australia, metropolitan, city practices. We haven't mentioned the Defence Force, so there's certainly members of the dental profession working in the armed services, and it's quite an interesting career, as well as research. And we also have pathways that lead to dental specialisation. So after your 5-year degree, you can work in practice and then maybe consider a path where you might want to challenge yourself further or have a real specific interest in. And our dental school offers a suite of postgraduate specialisation programs. And on the screen, there's just a few of them. And they range from maybe 3 years to 5 years, except for oral maxillofacial surgery, which also requires a medical degree. Okay. So that's just a range of all the different specialties. So we go beyond, say, some of the familiar ones like maybe orthodontics. Okay, that's just one of the main ones, but there's lots of other ones, like Professor Logue is actually an oral pathologist, so you can chat to him about specialisation in that field. So there's forensic dentistry, so there's lots of, and special needs dentistry. So we've got 3 brand new first year postgrads in that program at the moment, so it's quite exciting for them. And yeah, I think that's the main.
Thank you, Professor Lekis. I'm going to now just go through the entry process for you, and this is for domestic applicants. If you're an international student, it is slightly different, and there is a comprehensive admissions guide which I'd encourage you to have a read, or I can chat to you afterwards as well. So for those of you who are in Year 12 at the moment, it's important that you have registered for the UMAT or do it very shortly, because it's going to close shortly. You'll sit the UMAT and then you apply through SATAC, so the South Australian Tertiary Admissions Centre. In that application you can select 6 preferences, and if dentistry is your number 1, then you should put that as your number 1 preference. Based on how you go in the UMAT test will determine whether we invite you for an interview. The interviews are held in late November, early December here in this building, and when you receive an invitation to an interview you will log on to our booking system and you'll have some dates and times to select from. Please do that promptly, because you may not get to choose the particular date and time that you want. There is one spot for everyone, but it just may not be the one you want, so please make sure you log on quickly and do that. Now, there's also some prerequisite subjects that you need to do throughout, say, Stage 2, so Year 12, and there's 2 science subjects: chemistry, maths methods, specialist maths or physics, and then 1 from biology, geology, chemistry or physics. That might sound like a lot to take in, but we do have the details in our admissions guide for you to have a read through that as well. So once we have, and then we have your academic score. So your ATAR needs to be 90 or above, so 90 or above. Once we have all components of that, if you make it through each of those stages, then the interview is the first ranking level we look at, and then the UMAT is your second ranking level, and then your academic results, we need to make sure that you've met that threshold of 90, and then the final ranking level. So just to put that into perspective, if we were equal, if you and I were equal on the first 2 points and you got a better ATAR than me, then you would rank more highly than me. So that's how that's used to determine the offers. So I won't go through a lot of this information. I'm sure most of you know about the UMAT. You've probably been preparing for a little while. But just to mention that the university doesn't endorse any particular UMAT preparation courses. It's very much a personal choice if you choose to prepare in that way. When you do register for the UMAT, you do get access to some practice materials, and that they are written by the test centre themselves, and that is how we feel is best to prepare. But completely up to you, however you feel that you're most prepared for the test. So as you can see, it's coming up on the 25th of July, and registrations are closing very shortly. So as Professor Lekis mentioned, we have a detailed dental surgery admissions guide. There's also a separate one for oral health. So please make sure that you have a really good read. Show it to your parents as well, because they'll be on this journey with you. And so that you understand what the process means for you. There's timelines, critical dates and things like that. It's very important to remember that we don't accept late applications like some other courses do. So please make sure that you check those critical dates as well. Okay, so now we're going to have the opportunity for you to ask some questions to our student panel. So if I can invite Bianca, Calvin, Sinead and Alice to the beautiful red chairs there. It's one thing for us to stand here and talk to you about the entry requirements and for the academic staff to talk about the program, but these guys live and breathe it every day. So over to you. I'm going to ask them just to sort of give a brief introduction of who they are and perhaps what they like about the course the best, and anything else that they want to share.
Thank you. So I'm Bianca. I'm in my 4th year of the Bachelor of Dental Surgery. I'm originally from Adelaide. I actually transferred into dentistry, so that's a brief history about me. Something that I really love about the school and the experience is the great support system that we have from the staff, the extensive sort of history we have. So it's a very well-established school, and it's a really rewarding experience, which I'm sure we'll kind of dive into later as well.
Hi, my name is Calvin. I'm studying Bachelor of Dental Surgery as well, also in my 4th year. I'm originally from Sydney, but I chose Adelaide and I wasn't disappointed. There's excellent staff, early clinical hands-on experience, which I think really distinguishes us from the other dental unis around Australia. Also, there's a great student society that we have as well, which will give you great support if you ever feel lonely as well. So, yeah, Adelaide Dentistry is very good, so you guys should come.
Hello everyone, my name is Sinead Wright. I'm a second year Bachelor of Oral Health student. I'm originally from Mildura in Victoria, so I moved to Adelaide last year. I've really thoroughly enjoyed oral health, and it's presented me with lots of different opportunities. It's very exciting at the end of the year and even at the end of the semester to sort of sit back and reflect on everything you've learned. It's amazing how much you can learn in such a short period of time, and it's fantastic how each subject integrates, and yeah, you can really see that, especially this year I'm in clinic, and I can see that how everything's integrated nicely, and now we're putting it into practice.
Hi, my name's Alice. I'm currently in my third year of Bachelor of Oral Health. I'm originally from Tasmania, but I chose Adelaide because online you can really see all the different resources they have access to, especially the simulation clinic, which has amazing technologies which allow us to practice before going into the real clinic. And when you get into the real clinic, it's the most rewarding experience, and there's so much support from both the peers and the staff because it is such a small cohort into the Bachelor of Oral Health, so everyone's there to support you, and it's a really great rewarding experience.
Thank you. Okay, over to the audience. Does anyone have any questions for the students or the academic staff? Don't be shy. No? Perhaps the panel could maybe give some insight into what's been their best experience so far within the program.
Well, I think getting into clinics, so we've got different placements as well. I'm currently on my rural placement, so I'm in Whyalla Tuesday to Friday, and I think just the most amazing thing is when you first start seeing patients and you're not only looking after their oral health, but you're looking after their general health as well, and you're really an advocate for, you know, healthy general health, and it's really rewarding to take care of them and them to be so appreciative of the work that you do, you know, sending them out smiling, feeling more confident about their teeth. So yeah, seeing patients, especially for Bachelor of Oral Health, we see children as well, and it's really great to talk to them. It's a great experience.
Yeah, Alice just said that really quite nicely. Yeah, it is amazing to see, you know, the positive change you can have on a patient. I mean, I've, you know, only been in, I'm out at Elizabeth at the moment at a clinic, and I've only been there for a short period of time so far, but it's amazing already how much you can see that positive change, and, you know, each week when you're lucky enough to see the same patient again, and yeah, it's really great how just that promotion of, you know, good oral health can then radiate onto their general health, and yeah, it's fantastic.
I think the staff at the School of Dentistry is probably one of the best things about this school. They don't treat you like a student, they treat you like a colleague. They're willing to teach and help you when you have any issues. They're willing to email you at midnight. Even when you're asleep, they're willing to reply to your emails, especially Prof. Lekas over there. One of my favourite staff members in the School of Dentistry. Whenever I had issues, I would always reach out to her or any of my clinical tutors, and they're always willing to help. They're never afraid to palm you off. They're always there to support you and guide you through your dentistry or oral health course. So, yeah.
And just following on from that, the staff support is incredible, and we do see a lot of patients, especially in our later years of clinical practice, but in the earlier years of the course, we are sort of developing the manual dexterity in the simulation clinic, like a lot of hours every week, and the learning curve throughout each year is quite steep, just to be able to treat these patients as best and wholly as possible. And the transition throughout each year is very well done, mainly because of the staff and the sort of support that they give us. And even though you might find that treating patients is quite daunting to begin with, you have such an incredible support from both your colleagues, the staff, and also the other professionals that you're working with, so the assistants, the oral health colleagues, other specialists in the hospital. It's, you don't feel like you're kind of out of depth in the school, which is a great thing to have.
Anyone have any questions? Yeah, up the back there.
So really,
Sure.
I think...
So the question was, sorry, I'll just repeat that for the Facebook viewers. The question was, how would you best prepare for the interview?
That's a really good question. One of the biggest obstacles to get into the course is the interview after passing the UMAT. I would suggest doing the research, as Prof. Lekas had said, to sort of identify exactly why you want to be in the course. The best impression that you'll give to the interviewers is to show that you're actually really passionate about dentistry, oral health as well, and that sort of follows through in everything that you say. So you really wouldn't be very nervous about the interview if you're quite well prepared and sort of understanding exactly what you want to get out of the course.
Just to add on to that, just be yourself, okay? Don't try and be someone else. Be yourself, and we can see that you're genuine. And if you're genuine in coming to this course, then it's a good chance that, you know, you'll look good in their eyes.
Yeah, they've said that quite nicely. Yeah, I think it is really important to identify exactly why you want to do the course, and yeah, just have that passion behind that reason. And yeah, and I think that will go on then too. You really love what you're doing and you study. And
yeah, so to wrap up, yeah, it's really important to know what's involved in the course. So know what happens throughout the 3 years for oral health and the 5 years for dentistry, and just show your passion. Don't forget to smile, show your lovely teeth. Yeah.
Thank you, guys. Any other questions from the audience there? Now's your chance. These are the real-life students who you'll be where they are shortly, so now's the time to get all the information you need.
Sorry, Nicole, can I just add to that question about the interview? So as we've also indicated, there's lots of information on the university's website. So the admissions guide itself does give you the criteria for the interview for both dentistry and oral health. And I guess like any job interview, you would, if you're applying for a job anywhere, there would be a similar thing. Preparation, understanding why you want to be in the profession that you're choosing, and as well as understanding the course, as the students have indicated. But also the university has a degree finder, so when you hit on the university's webpage, there's a little box that you type in, say, dentistry or oral health, and it will take you to the program information guides, and that's where you can read about the programs in much more detail. Or say after you've finished listening to our presentation, it's got lots of explanations about, for example, in dentistry, the single integrated stream and what each year level involves and what topics and materials you'll be studying and the type of assessments we've got, and the same for Bachelor of Oral Health. It will name the four streams, and it will explain them as you move from first year to final year. So, yeah. And yeah, as we said, speak to members of our profession, different ones, not just one, and it doesn't have to have face-to-face if you're not able to. If you can pick up a phone and find someone, a friend of a friend or a colleague. It's very hard sometimes to get permission now to observe directly in a dental practice for lots of health and safety reasons, but even if you could just talk to a dentist or a health therapist and find out why, why they chose it, why they like it, about it, and some of the challenges that they face. So with every job there's good and there's some challenges and ways that they work around their challenges. And maybe our students can also afterwards maybe just indicate how they overcome some of the challenges that they face.
I just wanted to add to Dimmy's comments about, getting prepared. Don't forget our open day that comes up in, I think it's August. Each year, because I know it's difficult, particularly if you're in year 12, to do things like work experience, but we run tours of our simulation clinic. You can actually have a bit of a go on some of the equipment, and that gives you a bit of a feel for what it's like to work there. So when you come to the interview, you can say, well, I heard you've got a good simulation clinic, whereas if you said, I've actually been to the simulation clinic, I've seen it, that shows that you've got a real interest in it. So we encourage people to come along to Open Day and speak to us some more about your interest.
Thank you, Professor Snelling. That's really good advice. Yes? So the TAFE pathway, yeah.
I can probably answer that. And I've got to say that there have been graduates of the Certificate 3 in dental assisting that have done both the oral health and or the BDS. So we have had people in both courses with that background. Unfortunately, it doesn't give you any advanced standing in the course, but what it gives you is it gives you a wonderful opportunity to build on what you've got. So I know our oral health students that come into the course in first year with a background in dental assisting, you know, have a really great grounding in the materials, in working in a clinic. And what's really great to see is they work with our school leavers or people from other areas, and they're almost like a mentor to them. So I think it really is a great advantage, but we don't give specific credit for what they've studied, except I think it really helps. Yeah. Well, absolutely. And coming to an interview, I imagine if you've had experience as a dental assistant, that's only going to make your interview performance better because you've got a real insight into what you're actually applying for. I better let the students answer that because otherwise they might think I'm lying.
So speaking for oral health, I know the first 2 years are definitely very hands-on. Each day we're at uni from about 9 till 4. It does change around the timetable though. I know some students did have still that part-time work, and I think if you can work with the place that you work at, or if you're dental assisting, for example, and get, you know, a couple of hours a week or work during the holidays, it's beneficial, but it is definitely difficult to keep on top of the coursework. In the third year, the timetable changes a little bit, so we've got 2 main days we're at clinic and we're not on uni campus as much, so I think getting a part-time job is a little bit easier, but it's definitely stressed upon us that we need to still keep on top of the coursework, and even though we're not at uni as much in third year, we still need to use those hours to study and work hard at what we're doing.
Yeah, pretty much the same as Alice. I'm actually was a dental assistant before I studied Bachelor of Oral Health, and I'm still a dental assistant after hours. I did work a few hours in first year, but I would not recommend that. It was very stressful. I guess it can be done, but you have to be very, very organised, make the most for your time. It was beneficial working as a dental assistant after uni, because I guess the things that you would learn during the day, you'd almost, you know, you'd watch and obviously assist in the procedures and everything like that. But yeah, I think, yeah, definitely time management is definitely very important if that's something you'd like to do.
So currently Bianca and I, we are in our toughest year. We're also doing concurrent honours as well, but we're also balancing that with a part-time job. So I say it is possible to work and study at the same time. However, like the rest have said, you have to know how to balance your lifestyle, your leisure time, your hobbies with work and uni. Okay, so if you can do all that, then definitely work is possible. But if you can't do that, I would recommend maybe just focusing on uni for now, and then when you do have more time, then actually go find a part-time job or resume your part-time job.
Following from that, I have been working throughout my from first year, second year, third year to fourth year. I think it's a very personal choice, so if you find that you definitely want to work or if you need to work, that's fine. It is just about time management, building on your skills. I will say that it's really rewarding to sort of have a part-time job if you can manage it. Depending on what sort of field you're in, it's great to sort of expand your contacts and sort of create a balance in life. Dentistry and oral health are very intensive course. They are full-time. But having that balance where you actually go out and you meet new people, you build on your sort of teamwork skills, I think definitely consider getting a part-time job if you can. Maybe sort of developing a nice work relationship to sort of, with your boss to sort of balance it out. When you've got exams, they're normally quite understanding when you're a student. You can take some time off for study. But it is really a personal choice to sort of see how you feel. If you find that it's too much, especially in sort of third year oral health, second year, fourth year of dentistry, think about whether or not you're managing it well enough. Because in the end, the education side of things is really important, and the part-time job is probably less of a priority in your course, I think is safe to say. Yeah.
Thank you. Do we have any other questions? Yeah.
I was just wondering, what the graduates of the Bachelor of Oral Health, what can they do that the graduates of the TAFE course can't? Do you know?
Sure. Kathy, Yep, Professor Snelling would be able to answer that. So the question was around the TAFE pathway versus the degree pathway.
So if you're talking about the TAFE course in dental hygiene, yes. The dental hygiene course is what we would call a single outcome qualification where you can register as a dental hygienist. The Bachelor of Oral Health course actually grew out of a combined learning pathway for dental hygiene and dental therapy. So the dental therapy aspect of the oral health course, which is more about doing fillings, extractions of baby teeth, they do a wider scope of practice, but they also have the same skills as a graduate of the hygiene course in that area. And what we do have, which we'll just touch on briefly, is we have a lateral entry program for graduates of the TAFE hygiene program into second year of the oral health program to top up their skills to get the degree. So it's a bit like comparing what the oral health therapist does with the dentist. The dentist has a wider scope of practice. The oral health therapist has a wider scope of practice than a dental hygienist. Does that make sense?
Yeah, it does, yeah.
Great.
Thank you. Okay, I'm just going to ask the students if they could talk a little bit about their experience in the dental simulation clinic and sort of how they found that and how that's enhanced their learning.
So with Bachelor of Oral Health, as well as being introduced to actual clinical areas, we're also introduced to the simulation clinic from about week 2 still. And with this, we get some model teeth, and we really get to practice everything before we actually do it in real life. It's really great to, you know, make any mistakes that you're going to make on fake teeth before you get into the real clinic. And then at uni, you're working on, you know, interpersonal skills and working with patients and their health. And then you get to sim clinic and you practice the little tasks you're doing or the restorative procedures that you will do. And then maybe a few months later, you'll get to actually practice them on real patients. It's really handy tool to practice before the real thing.
Yeah, I think we're very lucky to have the simulation clinic facilities that we have here at the university. It's a very important part in developing those, you know, from the first, you know, second week of first year, those fundamental skills and, you know, developing that manual dexterity. It's vital part of the course. And yeah, definitely it makes you feel a lot more comfortable before you see a patient to be doing it in the simulation clinic in an environment where you can make mistakes and definitely learn from them.
I think we're quite lucky to be the first few cohorts to actually use a simulation clinic. It's quite new and advanced. It really helped me quite a lot because when I first came into dental surgery, I don't think my fine motor skills were top notch at all or even great. They're not still, but still improving, so which is good. It's very good, like the others have said, to actually practice at simulation clinic. There's a lot of materials that we could use in a simulation clinic, which we can use in clinic as well. And it's probably the best place to actually do your learning before actually going to practice or into real patients. So, yeah.
And following on from that, we have tutors per group of 9 or 12 who can actually ask questions throughout the entire sort of clinic session. And they also kind of look over our shoulder, make sure we're doing the right thing in case we don't know to ask questions. So that's really great and helpful as well. And it is available to us to use throughout the entire degree. So in 4th year, we actually don't have scheduled simulation clinics throughout the actual school year. There is a preclinical period, but that's a different part to the actual school year. And you can actually book in to make appointments to actually just have a seat, and you can actually bring in what you're planning to do in a clinical scenario with your patient, so you can actually practice a procedure on a specific tooth before you actually see the patient in real life clinic. So that's also really beneficial, and it helps us to sort of identify what we can do to improve throughout the entire degree. So that's really helpful.
Thank you. Is there any final questions before we move on quickly? No? Okay, let's just talk a little bit about student support, and I might get the students to jump in a minute. Here in the Faculty of Health and Medical Sciences, we have the Yates Indigenous Health Unit. So we have student support specifically for our Indigenous students through 2 Indigenous student support officers. So they can guide you from inquiry right through to enrolment, and then throughout the program as well. So please make sure that you access that. Both the girls are really fantastic and have both been at university. They understand the challenges, and so they're certainly able to help as well. And part of the Yatchaparuna Health and Medical Unit is a scholarship for Indigenous students as well, to help them throughout their university studies. There's more information in the admissions guide and online as well, as Professor Lekas alluded to earlier. One of the great things about coming to this faculty is the peer mentoring program that we have, and we certainly encourage anyone that's coming from high school or from anywhere really. University is quite different to high school, as I'm sure the students will tell you, and some of the students have moved from interstate as well. So I think it's important to have a look at any program that can help you in that transition, just to help you understand how to do uni essentially and how to be a university student, because it is quite different from school. Have any of the panel got anything to say about the sort of student support options?
Yeah, absolutely. Really extensive. So we've got the peer mentoring program on the screen here. I know that myself and Calvin are peer mentors this year, where we actually just register ourselves, we say a bit about ourselves, and then we actually have students who are a part of, sign up for the peer mentoring program to choose a mentor, and we actually meet up with them in a really small group setting, and we kind of answer any questions they have, sort of see how they're going, give them tips on exam preparation, clinic preparation, that sort of thing. There's also, within the Dental and Oral Health School, a student society called the AUDSS, and it's a group of students volunteering with separate roles, but we kind of create activities and events and an online support system for the students as well. And there's also a buddy program in that. So if you're an ADSS member, you can actually sign up for the buddy program, similar to the peer mentoring program, and have another sort of mentor to help you through the program as well.
Yeah, so I've been a peer mentor for the Faculty of Health Science peer mentoring group for the last 3 years. It's really great to see that your mentees have actually grown from all the advice you've given them. As Bianca said, we do have the AUDSS as well. I'm part of the Student Affairs Executive, where we actually run the buddy system. So what we do is if you enter into oral health or Bachelor of Dental Surgery, you can actually be paired up based on your interest and where you're from to a mentor in the upper years who can actually, like Bianca said, teach you and actually give you tips on how to pass the year and the grade. So if you do come into our School of Dentistry courses, please sign up for these peer mentoring systems because they're very useful.
I think what you guys said, the peer mentoring systems are really awesome for everyone that are coming through the courses to make the transition a little bit easier. Even besides that, I'm pretty sure all the students are open for any of the first years. I know that when I was in first year, we were forever talking to the second and third years, getting advice, coming up to exams, and even just support and encouragement. Any questions we might have had, we definitely sought out their opinions. So yeah, I think the whole environment in oral health and dentistry is very supportive.
Yeah, so I remember in the first couple of weeks of first year, we actually had like a little meeting with the second year and the third years, you know, have a bite to eat and have a chat to them as well. I definitely, throughout second year and third year, got a lot of Facebook messages from the years below asking questions and whatever. So it's a really great environment, and we've all been through the same thing. So it's really great to ask students, and I've just started going in for the second years on their clinic days as well. The staff and tutors are great and lovely, but as was said before, there's about 1 tutor per 6 students-ish. So it's really great to have, you know, students that have been through that and done this before when you've started seeing patients, because it can be daunting, and they can just ask, you know, any questions that they think are a bit too silly to ask tutors, and they can get just a bit of advice from us, because we've been through the exact same thing just only a year before. So I think peer mentoring is really great.
Thank you. Yeah, it definitely is worth looking into wherever you go. These guys have all been in your shoes. They've done it before, so their guidance is really useful. So just finally, do we have any other questions? No? Okay, thank you for attending today. We hope to see many of you as new students here in the future. Enjoy the rest of your weekend. Thank you for coming.